My next guest is Congresswoman Jahana Hayes of Connecticut, a member of the Youth Suicide and Mental Health Task Force on Congressional Black Caucus. She also serves as vice chair of the Labor Caucus. Congresswoman, it's great to have you on this. I'm going to ask you maybe an unfair cosmic question. When we look at the surge in mental health challenges and opioid addictions and suicides that are going on in this country right now, what is America not getting right in this moment that we have to fix to help people where they are?
That this is not, first of all, thank you so much for having me. But when we talk about mental health and addiction and suicide, those are not single issue conversations. We also have to address all of the intersections and the core issues that lead people into these types of circumstances. So we can't talk about suicide and addiction without talking about housing and healthcare and nutrition and all of the stressors and the underlying factors that create this ripe, fertile ground for people to become susceptible to those types of things.
When we look at the fact that now we seem to be making our way to the other side after the pandemic, and we know that the pandemic did not hit everyone equally in this country, that there were communities that were very hard, disproportionate, and they may still have hangover from that. We've seen it on the economic front. Do you have hope when we kind of talk about all those other systems that that's beginning to kind of level out for people?
I do have hope because we are at least having those conversations. I mean, when we are looking at funding for the CDC, we recognize that we have to talk about chronic health conditions. When we are talking about returning kids to school, we have to have trauma-informed counselors and care. So the fact that we are having those conversations, even though it resulted out of a pandemic, I think is very hopeful. You know, at the beginning of this crisis, we didn't even have full access to telehealth or for people to be able to reach out and address people in those ways. So the pandemic did have, while there were lots of things that were horrible about it, there are so many lessons that we can carry forth to make the delivery of these services to the people who need them the most a lot more affordable and a lot more accessible.
When it comes to the legislative agenda, now in this show today, we're talking to someone that you've been working with a bit, Congressman John Katko, a Republican of New York, and he signed on to some legislation that has passed in a Democratic-controlled Congress. I'm just interested in, legislatively, when you look at both what's passed and what the horizon is, what is on your agenda being most important?
Well, I think the holistic viewpoint, just funding these programs is not enough. I'm very concerned about the impact that addiction has on our youth. So making sure that we have those wraparound services in schools. I introduced legislation to save education jobs to make sure that as districts are thinking about their next steps, they are not cutting social workers and guidance counselors and therapists, all of those people who deliver services on the ground at school, that for many of our young people, that's the only place they're getting them. I introduced legislation to make sure that we are increasing funding on college campuses to make sure that there is access to addiction and recovery services. Just making sure that those things are available in our communities. I think oftentimes when we think about addiction or mental health, we think about just the person or the person that is affected. I want to make sure that we are also addressing the needs of the families and children that are affected by addiction, by mental health, by recovery. All of those people who showed up in my classroom and quite frankly, were me as a young girl. So I want to make sure that we're looking at this in a very holistic way to address the needs of our young people and the people who are impacted as a result of a family member or a loved one being dependent. And also, I think equally as important, to make sure that we are legislating in a way that recognizes that addiction and mental health are health issues. Those are medical issues that we have to address just as we would any other health condition.
Congressman, let me ask you a question. I'm not sure I'm going to get it out right, but it's sort of been on my mind. This is Pride Month. We have lesbian, gay, bisexual, transgendered, often young people, sometimes community of color. Mental health is also, a challenge for some people as they find themselves and declare themselves, come out. I've talked to folks from the Trevor Project, about the aid and assistance that they've tried to give people in these communities. And I know there are many other communities out there. You've been dealing with the VA. But as we saw with the pandemic, we needed ambassadors that people trusted to reach them. We needed folks in this. And I'm just wondering, as we think about this at the federal level, do we have the right partners? Do you have any thoughts or insights on how we can reach people where they are?
I think that's a great question. And you're right, we do not have the right partners, because part of this is about relationship building. I'll give you a perfect example. I now chair the Subcommittee on Nutrition Oversight and Departmental Operations. And myself and Congressman McGovern are calling for a White House conference on hunger. But it's not just with the medical and the legislative professionals in this area, but it's schools and faith-based leaders and community partners and people who are the recipients of benefits, all of those people who have a very different perspective on this very important conversation. And I think we have to take that same approach with anything that we're having. You are not going to send, a straight person into the community, the LGBTQ community, to be a validator and to talk about the importance and the needs of some of these programs, or even to know who to speak to or how to speak to them. We need people from within the community to be the ones that are at the table, leaders in their field, gaining the information, and then bringing that information back to their respective communities. And that has to happen across the board. Actually, we have legislation right now to diversify the medical profession, to make sure that we are offering scholarships and opportunities for young people from various communities to consider a profession in healthcare, so that they too can in turn infuse that pipeline and be the person in these communities that may have cultural barriers or language barriers or religious barriers or things that an outsider just wouldn't understand. So all of that is important as we move beyond this pandemic and make sure we are giving people exactly what they need to rebuild their families and be healthy in their communities.
Thank you for that. Congresswoman, you have also, I'm going to get in one more question before we go to an audience question in, but I'm really fascinated by these different communities, and you've touched so many of them in your time in Congress, but you sponsored legislation, the Bipartisan VA Mental Health Staffing Act, the VA Mental Health Counseling Act, and I just, as I asked Congressman Katko, has he interacted with Secretary Dennis McDonough? Do you see the VA under Secretary McDonough, the Biden administration, the folks at HHS, putting enough priority right now on mental health? I know there's a lot on their plate, but the question is, are the priorities where they are? You just asked for a White House conference. Are there other things like that we should be doing and expecting the administration to pull behind, particularly with veterans?
Well, veterans is a priority area of focus for me. I have so many veterans in my community. But to your point, to answer your question, I don't think that it's all in the White House. I think that we as legislators and community members also have a responsibility. Public sentiment is everything. I had to educate myself very quickly on the needs of the veteran community. And I did that by listening, by reaching out, by engaging with stakeholders, with veterans, and asking them what they needed, and then going back to Washington and using my agency and my capacity to write bills to close those gaps and address their needs. And I think now we'll do the same thing with this current administration. As I'm hearing from my constituents, I will elevate it up the chain to remind them that first, not only do we have a moral responsibility, but we have an obligation to provide these services for people who have, in many cases, made the ultimate sacrifice for our country. So this is an area, I went to Congress as a classroom teacher, so education, labor, some of those things were a lot more just familiar to me. The veteran space is an area that I had to familiarize myself on, and I did that by listening and learning. And I think every elected official has to do the same thing, especially out of the agency that directs Veterans Affairs. So I will make sure that I will continue to elevate these things. Back in March, I visited a VA hospital, and I heard from many of my constituents that their spouses could not get vaccinated, and they were just concerned about that. Many of them were the caregivers. We were able to quickly draft legislation, and within the space of, I think, probably 2 or 3 weeks, the president signed it into law. So they are listening. They are listening to us. We are listening to our constituents. And I am hopeful that this will be a priority especially in this administration, because the President Biden, really has a deep understanding and appreciation for our service members and their families.
We have a question for you from our audience. Ryan?
Hi, my name is Ryan Greenstein, and I'm the Legislative Director for the National Association of Attorneys General. My question for today's panelists is, with a new administration and a new Congress, what are the prospects for Congress this year eliminating the DEA-X waiver in an attempt to increase access to medication for opioid use disorder through legislation such as the Mainstreaming Addiction Treatment Act?
Well, thank you for that. So the question is really, I think, an important one. What can we do at the federal level on providing, at least the pharmacological response to some of the addiction challenges we have in the nation?
I think we tried, and actually this has always been a priority. This isn't new. In the 116th Congress, our very first HR 3 was a bill that had to do with lowering the cost of prescription drugs and just, I guess, reshaping our relationships with the pharmaceutical industry. So that has always been a top priority. I think there is more of a chance for that legislation to move and similar legislation in this administration, because we have an administration that is listening, that wants to make sure that while we are addressing, the research, the development, that part of the pharmaceutical industry, we're also addressing the part that directly affects patients, and that is the cost of prescription drugs, the accessibility, the affordability of those things. So we have remained, our foot is still on the gas on that issue, and I think that everyone has a different level of urgency coming on the other side of this pandemic. So I really am hopeful that we will see progress in that area, especially.
And just a quick follow-up on this. Does this DEA-X waiver issue come up in discussions when you're with your caucus?
It has not. I think the specific issues like this, and I think that's the great thing about being in this role, oftentimes stakeholders or constituents or panels, questions like this bring things to my attention, and then I can in turn bring them back to the caucus. This has happened on so many other issues. At the beginning of the pandemic, when we passed the original CARES Act, I heard from so many small businesses that the very small businesses didn't have access to some of these loans. We were able to take that information back to caucus and make sure we addressed it. So this is very similar, where it's not something that had come up, but the fact that it's brought up today in this panel gives me the opportunity now to just be the facilitator for this conversation within our caucus.
Congressman, I'm going to sneak in one last one. I'm just really interested in the time. I spent time in Congress. Of course, you're there. This is an area in which there's been bipartisan support. Do you think there are human moments and human needs like this where people come together in the legislative branch of government, they get to know one another, and they actually see themselves as people dealing with real people problems? Should we have any hope that the toxicity in this town may decline by you having more success on this front?
Well, I can tell you, I came to Congress from the classroom, and never in my life have I first been identified by my political party, the D behind my name. I never dealt with people like that. I never had that expectation of people. So that was very jarring for me when I first came to Congress, the political divide. A lot of this for me, well, for every one of us, should not be about politics. It's about policy. And the thing that I would say is no one can say, I think there's an irony in it when people in Congress say, oh, well, this was their position 5 years ago, and now they've reversed course or they changed. You should change as you're in this role, as you are hearing from people and learning what their challenges are and recognizing and appreciating what we can do to help them. Your position on all of these things should evolve. And I don't think anybody is the same as they were a year and a half ago. This pandemic has just revealed so many gaps and so many inequities and so many challenges. And many of these stories are heart-wrenching. And I think as legislators, we have the ability to change a lot of that. So I remain ever hopeful. We continue to try. I just actually introduced legislation with my Republican ranking member on my committee to make sure that we are extending school meals to kids in foster care and being raised by grandparents. That's a major step to get, my counterpart on this committee. We agree that kids should eat. And we had to sit down and work together on what that looked like and the things that we would agree to, but we were able to do that. So I can assure you that I will continue to do my part in that area and really just appeal to my counterparts, my Republican counterparts, to do the same, because their constituents are hurting in the same way that mine are. And there are so many things that we can do together.
Well, Representative Jahana Hayes of Connecticut, member of the Youth Suicide and Mental Health Task Force in the Congressional Black Caucus and Vice Chair of the Labor Caucus, such a pleasure to talk to you today. Thank you very much, and I hope you will come back and talk many more times with the Hill.
Thank you.
That brings us to the end of our program today. A big thank you to the Hartford for its support and to all of you attendees for joining these very important conversations. For any of you who missed these conversations, we're going to have the video up from the event on our website shortly. I'm Steve Clemens. Be well.